Yeah. I mean, we're happy to do what we can, but we recognize the times don't work for everybody, and not everybody's even here. So yeah, happy to plug in where it makes sense.
Okay.
All right.
Let's get started. So what I'm looking at right now is, so obviously we're here to talk about ancillary reviews in the process, and we'll go through the demo right after this, but we want to share this worksheet that we've created that outlines the different types of ancillary reviews that we have identified here at DH. Let me see if we can zoom in just a little bit so you guys can see that a little better. This first block of ancillary reviewers are ones that we expect to be completed prior to submission to the IRB. So we have the Cancer Center Review Committee, the Scientific Review, the Departmental Review. For those of you who haven't seen, we did post in the templates and forms page on the intranet and the internet is now the Department and Scientific Review form. So that is available for your use. Moving down the list, we have a box of ancillary reviews that we expect to be completed during the IRB pre-review. So this would be any sort of consultants that we need if we didn't have the right expertise identified in our IRB to review the submission, then we would include consultants. And then conflict of interest. So we would be talking to Claire here from the DH side. Hi, Claire. Thank you for introducing yourself. We also have Henrique over at the college that we would include on occasion when needed when we have college staff on the submission as well. Any comments that you want to add to that, Candy?
No, I think the one thing that I should point out, and I just sort of explained even the document that we're
looking at is this document will be posted to the website. It's going to be part of the overall toolkit that's available to everyone. And what it's doing is really meant to help you guys and PIs and study teams when preparing a submission to know which ancillary reviews would be needed to even let you start the process of managing ancillary review. If you miss one, no big deal, because we can still do it once you submit to us, but it's meant to help us get a little bit, like even one more step ahead in the process. And then, so what you're seeing is the first section Jocelyn went through is, you know, things that we know are done prior to it ever coming to us. So that's not a surprise, departmental or scientific review. And then if we, as we scroll down, completed during pre-review. So really that's on us. If you guys identify COI, for example, during the managed ancillary review process prior to submission, Claire would get an email when you actually submit to us, letting them know that there's something in the system that has a conflict of interest so she can look at it. We want to make sure that we can work with Claire to get the information that we need about the conflict during the pre-review process, because if there's anything about that conflict that impacts the IRB's decision or how information is communicated to subjects about that conflict, we want to make sure we do that on the front end before I even put it on the board meeting for review, because otherwise now we're getting into a loop of going back and forth with COI where we could say, you know, here's the disclosure that needs to be made to subjects, add it to your consent form, and we do it all part of one shebang, right? So yeah, I'll let Jocelyn jump back in, and we're in the next section. So these are things that we would want done prior to the IRB issuing our final approval. Go ahead, take it away.
Right, so on this list we have radiation safety and investigational pharmacy. So we have some contacts here as well that we've identified for these areas. Moving on, and these are areas that would need to be completed but would not impact our IRB review. These would be things like clinical trials office, the regulatory review for drug and device guidance, which is Christina, and clinicaltrials.gov guidance, which is also Christina. So we would probably let Christina know that some of these are happening, or just prompt that this information is happening. You're also welcome to talk to her outside of the system to make sure that these items are taken care of as well. Any questions about these so far? Okay. And these are things that are post-go live for us. So these are processes that we have identified that need to be looked into a little bit more, and some of them We're still waiting for the office to come up and running, so we don't have contacts for some of these at this point in time. So this includes Institutional Biosafety Committee, Clinical Informatics, the Blood Bank, stem cell research oversight. Candy, I think you said that some of these offices aren't yet fully set up. So we will start identifying contacts and update this form as these offices are staffed. So
I think the one thing that I'll throw out there with this as well is that we know that there is some process
development and finesse needed after go live. We have room for that, right? We just want to make sure that the right ancillary reviewers are getting access to your submission. That's the entire point of having ancillary reviewers in our system. We're not going to manage the communications. For example, let's say if Claire has things specifically that a study team needs to do, this doesn't replace Claire's process or Claire's system for COI. This simply allows her view access into an individual study submission, so she has all of the information she needs. And if there's anything specific to the IRB's review, she can let us know in our system. So all the ancillary review processes remain the same. It's just now they have a way to look at your IRB submission in the system. So maybe reduces the amount of information you have to provide across systems and can consolidate.
okay. All right. We'll move into the demo if there's no questions about that. Candy, do you remember off the top of your head what the IRB review was? Okay. The IRB. Okay, so what I did was I just logged in from the home page with my username and password. Update for those of you who don't know yet, what we're going to do on this main screen right here is there's going to be, oops, it's not going to show me now. There's going to be two different areas. So there's going to be one area for rapport users, for current rapport users. So if you have active studies that are transferring over to the DHH IRB, you want to continue to use your rapport login. There's also going to be a DH login over here. We can use your DH credentials to log in. And that's for new users, for users who do not have studies pulling into rapport, did not have a rapport login previously. So just so you know how that's going to work. Yes?
One quick question. I was asked, I can't remember if you guys talked about it, with the PIs that are currently in there. So when my PI has Dartmouth-Hitchcock, you use whatever's been registered and being utilized on rapport, or you can automatically jump to the Hitchcock one.
If you have a rapport login and that's what you're using to manage your studies, you should be using your rapport login.
But when you contact PI,
right.
When you use whatever email has already
Gotcha.
been in the system, or
When we contact PIs, it should be in the system.
okay, so
So
it's
when we talk to you guys, it should be what's in the system. So like if there's a notice that we've issued modifications required, the notice that goes out is tied to the email that was already in the report system. Yep. Yep.
Okay.
And so the clinical trials office doesn't manage any of the studies, but we often do go in and pull documents. Probably they have an IRB approved, or sometimes there's a new protocol version in there. You could still use our current report login and passwords, or are those going to change because we're not actually manipulating any of the study materials?
It should be accessing the system in the same way that you've always accessed the system to this point. That said, I know when we were preparing the ancillary reviewer list, we were using the email addresses that we had. Now, I'm going to tell you, not every person in the clinical trials office was given to me as an ancillary reviewer. So if we need to get some additional people in there, then if I could ask if you could shoot me an email with who they are, because it's not even necessarily an ancillary reviewer at that point, it's a global viewer, and we have to set you up a little bit differently. So if we need to do that, just shoot me an email and let me know who the people are and their email addresses, and we'll get you in there.
Does that work the same for Dartmouth College people who were, because we're still going to be Dartmouth College until about October, until we come over to DH. What happens at that?
Use rapport. Keep using your rapport credentials until you hear something different. So if you've already been working in the system with rapport credentials, just keep doing it. And that's because that's how everybody's tied to their records right now. Ideally, eventually, and let's just say future state, because we don't even have a timeline. We want to shift everybody into using Hitchcock, but to make sure that, to really minimize the risk of you guys not being able to access what you need to access come Monday, we didn't want to disrupt that apple cart, right? So we're going to keep the rapport credentials. Now, if we have somebody new, so let's say they need to get DH credentials so they can log in.
I think anybody new coming into the OCR is coming in under DH.
Okay,
So
that
that
helps.
shouldn't be an issue.
Yeah, sounds good.
And there will be some text on the page when you log in sort of explaining this as well. So just pay attention to the text, use the right ID according to your status there. So that's great. Okay, let's log in. So when you log in, just like, researcher or study team, you're going to have an inbox and you're going to see the items that require your attention. So you probably should have received an email saying that there's an ancillary review. You've been assigned as an ancillary review. So here is a study that I'm going to go ahead and review. It's 31534, so click on it. And you can see that you have, you can pretty much take no action on the study, which is exactly what we want, except for the submit ancillary review option here. So you can't edit the study, but you can view the study either by clicking the view study button and navigating through the smart forms, or you can click this printer version, and this will pull up every single document, all of the information that you need for this study, all in one little form. So that's a little bit easier to navigate if you're looking at all at once. Once you're ready to submit the review, you'll click the Submit Ancillary Review button. You'll see, and this look a little bit cleaner, I think. Oh, it looks okay, actually. Okay. You'll see the person that this is assigned to, so you can see Ancillary Reviewer, that's me. The type of review, so we have CCRC here. And I want to talk about CCRC here in a second because I know that you've been assigning yourself as reviewers. Is that correct? And then completing that? Is that the way that, okay. We're not going to do that anymore. So if you have the review submitted, or if you have the review ready to go when you submit it, just put it in the other supporting documents tab. Don't assign yourself as a reviewer and then complete the review. Just when you're in the edit study function, just submit it with your other study documents.
You're talking about CCRC approval and.
Right,
okay.
Correct. So any CCRC approval can go with your other supporting documents and your study documents. So don't assign yourself as a reviewer anymore. Just submit that with all the rest of your documents. So you would need to click here to say yes. So you can see that required state is yes here. Now, if this isn't submitted, there's nothing in the system that's going to prompt us to not continue the review. We're just going to have to be checking these to make sure that these are done internally. The staff will be checking these to make sure these are done. Do you accept the proposal? You can say yes or no. If you say no, please add some sort of comment in here explaining why the submission is not being accepted. You also have, just like any other area here, an area to upload supporting documents. So again, this will just pull up your screen where you can grab any sort of supporting documents. If you have a file that associates that explains why you're not accepting the review, you can add that at that point in time. You can add the Department of Scientific Review form if that's completed here as well. So. If you say no, I'll go ahead and show this, so we'll go ahead and say no. Study team members will be able to see this activity if you're logged in as a study team member. So just like the answer review function here, you'll see this reviews tab, and you will be able to click on this, and you will be able to see what is completed. If they have accepted, any sort of comments and documents will also show here as well. So if you're wondering, hey, this study's been in a state for a little while, maybe something's being held up with the answer reviews, you can actually go in here and check. You can also see the comments as well and start responding to those, to whoever left those comments. Again, there's no system change here with the answer review being submitted, so there will be no email notification to the study team when these are completed. So since we aren't really managing some of these activities, we ask that any sort of correspondence if you want to check in or you need to have further clarification on some of these answer reviews, maybe send an email and check in on them. So any questions on this at all?
So currently, we would just continue to add the people to the ancillary review. So it would be Richard Rothstein and Richard Halo.
So who's that for? What, departmental?
Yeah,
Departmental? Yeah, so all the departmental reviewers, we got the list and we've added them in. And so the way that it works when you're assigning them is, actually, do you want to log out and log
Sure.
in as a PI and we'll execute that activity just to show you. It should look really the same.
the same.
Yeah, nothing about this in the upgraded version of the system is really any different. But you have the option, right, when you log in. Just let her log in rather than try to picture it. We'll just show you.
I'm going to withdraw the study.
Well, you can still, yeah, we can still do it. Yeah, so if we select add up at the top, and so you either have an organization or a person. Does this look the same?
Yeah.
Yeah, and so we have the list of all the people, at least, you know, that we were given from CPHS. So you can add an organization, and if you add an organization, then that helps. Let's say if we have multiple people that need to look at it for one thing, you can select the organization and then multiple people are notified. If you have specific individuals, you can also just add the specific people here.
So I'm going to also whatever review type it is as well. So the department review here is there as well. So okay.
Great, thank you.
I think that's mostly it. Candy, do you have anything to add?
No, that's really it for ancillary review. And what we wanted to do was sort of show what it looks like for people that will be doing the ancillary reviews. One of the things, actually, can you hit that manage ancillary reviews again?
Sure.
So that and hit add, please. One of the things that the spreadsheet that we were creating or the toolkit document we created is meant to help with is if you guys are managing the ancillary reviews, is a response required? And we're trying to help you understand like when you should say yes or no. For that environmental scientific review, always yes, right? We need to know that that's done before we move the submission on. But like where we showed clinicaltrials.gov or regulatory review, that's not required, but we just want to give them access into the system. So it's not required for us to move forward in the IRB review process, right? So the other thing I like to talk about is that how you answer that question doesn't have a system impact, that has a person impact. So the way you answer that question will tell us in the IRB, can we actually keep the study moving, or do we have to wait until something is done? So that toolkit document we showed at the beginning are sort of us helping you guys know where we will stop. So if you're not sure, we will have some stopping rules that the system doesn't enforce. So if we have to be nimble and move something along, even though our rules say we shouldn't, we can do that. But where we know we need responses, I think COI is a really great example. We have to have that information because it does impact what the subjects get in their consent forms. So we will have the ability to manage that. And if you guys get those answers wrong, we can always help to fix it. So we just want to make sure you guys have as much information as you need or we can give you about when to add what in the scenarios. Okay, great. Any other questions we can answer for you? Any concerns I can help with? But what everybody's getting is that it's pretty much rapport. Just looks a little different. It's just newer, right? So it's just a new car, same model. Yeah, so Jocelyn and I will be available to help come Monday when the switch turns on. And if you don't mind, send me that list. I'm happy to get that in.
As far as like, because we don't have multiple different studies, search on how you